Hi, I'm Dr. Sridhar Kalyanasundaram. Welcome to my channel. In the previous video, we discussed about infant formula in brief, and in this video, we will discuss about whether there is any difference in the different companies' formula and how much milk the baby can be expected to take when they are formula feeding. So, most of the multinational companies, the reputed brands that we already have. So we have Nestle, White Nutrition, Similac, which is from Abbott. We have Aptamil, Babylac from Danone, and Enfamil in UK, for example, or US, SMA, Covengate. So these are all multinational brands. The formulation is not much different. They learn from each other, they compete with each other, and the quality standards are fairly well maintained. So if you know it's from a good multinational company and it's a reasonable formulation to suit your baby, it's safe to choose it if you want to use formula or you need to use formula for the baby. Again, I reiterate, go through my playlist on breastfeeding, because you should not use formula unless there is a real need. A baby looking hungrier or crying more doesn't mean the baby needs formula. So look at the growth pattern, discuss with your pediatrician regarding whether the milk is adequate, and avoid the formula as best as you can and support breastfeeding from the start. So if the baby needs formula, the choice between the different companies is according to your choice, and there is not much to choose between the different brands. There are differences which some babies may tolerate certain formula better. There are special formula which are made for certain situations. For example, the first few weeks, as I said, there is a physiologic lactose intolerance, so a slightly lower lactose containing milk like the comfort milks may suit the baby better. There are babies who have reflux, where the thickening material, either carob bean or cornstarch, makes the milk thicker. That may reduce the risk of reflux. There is some evidence to show that it helps, but mild reflux does not need such milks. Only the severe reflux needs the anti-regurgitation milks. The anti-diarrheal milks are not routinely used. They are used for older kids who have diarrhea for a brief period of time. Again, to face the secondary lactose intolerance these babies may have, it's only for 2 weeks or so that you consider using them. The anti-constipation milks or the AC milks may have less calcium or change the ratio of the fatty acid binding, which makes the calcium hardening the stool less likely. We have special infant formula for cow's milk allergy. We have hypoallergenic milks, which might help reducing the risk of allergy if you have a strong family history, but there is only weak evidence to support that. Milk allergy is a different condition, and we have dealt with that in previous talks on this channel as well. So the amino acid formula or the extensively hydrolyzed formula are used, and usually you should discuss with your doctor about that and not self-treat. There's also the hydrolyzed rice-based formula. This is not the rice milk. This is the hydrolyzed rice-based infant formula which can be used. So remember that if there is milk allergy, changing to goat milk-based formula is not going to change it as well. And buying a more expensive formulation of goat's milk is not any different from giving cow's milk-based formula as well. So the volume of milk will be discussed in the next brief video on formula feeding. Thank you.